Thank you, Sanjana Madam, Dr. Uma Balti Madam, Dr. Gaurav Gupta, and the all for this opportunity and the inviting us in this noble cause of the MD community. IAP the associated with the internationally also with the American Academy of the Pediatrics, International Pediatric Association, South Asia Pacific Organization, and Asia Pacific Countries Association, and many more associations across the globe. So here, second slide, please. Second. Again. So here the discussion, what is the role of the pediatrics? I will then we will focus why it is on the focus on the pediatrician, and what is the current status of the MD awareness in India, and we have to propose initiative and the expected outcomes and the conclusion. Next. So our Indian Academy of Pediatrics is inception in the 1963. Previously, it was the two organizations. One is from the originate from the Kolkata and one is from the Mumbai. And in 1963, both the pediatric associations merged and the central office in the Mumbai. More than 45,000 members, over 32 states, 337 state and city and the district local branches, one foreign branch at the London, and the 30 sub-specialty chapters and the groups. And the alliance with the government of India, state governments, FOXI, Indian Society of the Perinatology, IMA, and the SOMI. So SOMI is the midwifery society. Next. Context. Muscular dystrophy is the group of the genetic disorders marked by the progressive weakness and the degeneration of the skeletal muscles. And we all are discussing since the morning about this, all this disease pattern and everything. Now it is time to early diagnosis and the management can signify improvement the quality of the life. So here our motto is to give the healthy, happier life to all the children suffering with the muscular dystrophy. Next. Why the focus on the pediatrician? Because, next. So pediatrician are the first contact. While the childbirth, pediatrician are attending the delivery call. And the first contact start with the pediatrician while the child deliver, for the vaccination, for the any illness. So we have to focus on the pediatrician. So guidance and support required for the pediatrician, because pediatrician can guide families through the diagnostic process and the treatment option. What are the newer modality available in the country or the outside the country? They can know and they can give guidance to the families. Then the preventive health. Prevention is the better than cure. We all discuss about this genetics and all this family inheritance about this disease. So educated pediatrician can advocate for and early implement the early intervention. So current status of the MD awareness in India, some knowledge gap is prevalent still. All the pediatrician or all the medical doctors are not fully aware about the muscular dystrophy. So there is a lack of the widespread knowledge and the specialized training among the pediatrician regarding the MD. So what are the resource availability? Because some limited access to the advanced diagnostic tools and specialized care, especially in the rural area. See, just now me and Dr. Gaurav Gupta discussing about this, all the current presentation going since the morning. Many things are occurring in our country, but we all as a doctor also are not knowing, because research is going on. Tata, Narayan Netralaya, everyone is doing the research, but we all are not aware. So there is a knowledge gap of the pediatrician also, medical officer also, and the IMA doctors also. So we should give this some knowledge to our pediatrician and the medical doctors. Next. So what are the proposed initiatives? We can conduct the Muscular Dystrophy Day virtual meetings on the schedule of the 7th September. We should create the awareness on that day, specifically on the DM dates. And to update on the advancement and the challenge in the MD. The engagement with the regional chapters, like Solan here, this organization doing wonderful work. Since last means before 2 months, I was not aware about this institution or organization in the remote place. This organization doing the subnormal work. But after meeting with Dr. Gupta's call and Sanjana madam and all, I came to know about this institution. And especially I want to visit this institution in person. And I promised madam, I will stay at least 3-4 days. But it could not happen, madam. And I have travel expenses last weeks also. Since last 1 month, I have official vacation, but I am on the tour from every week. So here we have to engage the Himachal Pradesh and the other nearby region to enhance the care delivery in this region, and then we can percolate this in the other regions also. Next, please. So educational resource and the support, parent education, the IP publications. We have a official publications and in like Child India, every month we have a Child India magazine we are publishing. And in this regard, we can percolate all these activities regarding today's meeting. Me, Gaurav, and we have decided all the pediatrician will have a photograph with all of you. And then we can post in that magazine. So they will circulate to 45,000 members and all the WhatsApp groups and the official mass email. So they will come to know about this organization, what is the going on here. Then the resource for the pediatrician, developing guidelines for the counseling parents and the updating on the genetic advancement MD care. We have a parental guidelines on the specific disease in 2021. Dr. Piyush Gupta sir as a president have made 110 guidelines for each common disease. But some is like this, rare diseases are lacking. So we can make these guidelines and create awareness about this. Next, please. The formation of the high-powered committee. In among us, we can create and disseminate the scientific guidelines on the MD care. Pediatric super specialists like Dr. Anu madam is here from the PGI Chandigarh. So we can have a core group of these members, super specialist member, with the physiotherapists, therapists, and the patient advocacy group. And even coming to this knowledge about this or research activity going on, we can also have a committee with the Tata or this Netralaya group, and we can make some group for this advancement of research also. And madam is also interested to have some research on this area, so we can enlighten on this and we can percolate that also. So collaborating this all, we should make like something in our poster groups. Then output publication of the consensus statements in our journals and the social media platforms. IIP की बात community के साथ is our this year new initiative to create awareness among all the parents, teachers, and the community overall. On the 13th February, we have created this anemia program, then the Down syndrome, then the immunization, autism. So we can cover something in the next year. This year we have already have an event of the calendars every month. So we can make something like for the MD also. Next, please. So close coordination between IIP and the IMD. IIP की बात community के साथ. So this is our president action plan, and the presence in the national IIP conference. We can talk about this in our journal conferences, state level conferences, and create more awareness and for the pediatrician. And regular interaction with the IMD meetings and the IIP meetings with the discussion on the MD diagnosis and latest treatment option. Because all of you people are knowing more than any pediatrician in the country. Because you are working on this specific field. So we can interact and we can generate more awareness. Next. Next, please. So enhanced knowledge base, pediatrician across the India become the more proficient in recognizing and the managing MD. So anyone from this suffering family is attending their family pediatrician, they can give the more guidance to them and they can recognize manage the MD better than any other doctors. So improve patient care. Early diagnosis and the intervention become more common and improving the patient outcome. Increase public awareness. Public awareness leads to earlier presentation and potentially fundraising for the more resource. See, we are seeing the Indian oils have given the more academic supports or this CSR support to you. Like we are also having a CSR funding something, some companies. We have a most probably pharma companies, we are having a pharma companies support. So we can create something like that also. And we can collaborate on the government platform also. While we can attend the meeting in the government of India or the state governments, we can send the message for the specific like because we have more than 5 lakhs families across the country. So we can make something for them also. Next, please. So call to action, urge pediatrician to be vigilant in the recognized early signs of the MD. Wherever is some weakness, we can have an alert and we can recognize them and then encourage active involvement in the MD care and the collaboration with the IMD and the other stakeholders. Emphasize the collective responsibility to improve the lives of the children with muscular dystrophy. All of us are working for this noble cause, and our goal is to give the best quality life to the people, those who are suffering and their family. So we can support morally and whatever the financial support we can give in the treatment support, we can collaborate on this. Next, please. So thank you. Thank you very much, Sanjana Madam. The beautiful, wonderful pictures from your website, Dr. Govt created for this. So thank you very much. Thank you.